All right, welcome back. And this lecture is going to accompany the section 5.4 in the Open Stax textbook. And what we're going to be talking about here briefly are the diseases and disorders and other injuries that are associated with the integumentary system. And so to begin with, I want to talk a little bit about the diseases of the integument, which frequently are forms of cancer. And there are a couple of different forms I'll be talking about in a moment, many of which appear to be associated with increasing exposure to UV radiation. And so the exposure to UV radiation, which might have been caused from excess UV because of the damage to our atmosphere by chemicals that reduced upper atmospheric ozone layers, which used to sort of protect the surface of the Earth from these high UV radiation, have been damaged over time because of the release of industrial chemicals and things like that. And so there is this additional overexposure to UV radiation. Which might have resulted. But in any event, we tend to try to take care of our skin in a couple of ways. One, stay out of the really, really direct sunlight during the middle of the day when we know the UV radiation is at its most extreme angle and can penetrate the skin the deepest. Alternatively, you can put materials on your skin to produce that same effect, sunblocks of various kinds. In any event, if you do get this overexposure to exposure to UV radiation, those very high, powerful rays can cause DNA damage. And since you're thin, your skin, your epidermis is so thin, and some of the cells in the stratum basal are dividing so rapidly, they're particularly at risk of DNA damage. So putting the things that you know together here probably will make some sense. The stratum basal rapidly producing new cells. That means they're constantly going through DNA replication. So if you go back and think about that chapter, remember what happens during DNA replication is the chromosome is unwound and the hydrogen bonds between the two strands are split apart by helicase, and then the new strand is laid down along the old strand, the parent strand. And so as that happens, you can get errors, which we just simply refer to as mutations, that take place. And this is referred to as DNA damage. And these mutations can cause the cells to have all kinds of problems. One of the things that they this damage might cause is the inability of the cell to regulate its own growth. And what happens when cells lose the ability to regulate their own growth is cancer. And I know that Travis in a lecture talked a little bit about cancer and when he talked about cell division. And so I'll put all these things together, the DNA replication during during cell division that exposes that DNA. And then if it's hit by these high powered UV radiations, you can get mutations, and those mutations can lead to the ability of that cell the inability of that cell to stop dividing. So a couple of different kinds of cancers that are frequently found in the integument. Number one, the basal cell carcinoma. So this is something you should be able to put together now. If you've heard about basal cell carcinomas, what are basal cells? Those are the cells that are found in the stratum basal. These are the stem cells that produce all the layers of the epidermis. And when these are damaged when the DNA of these cells is damaged by these UV radiation, what happens is they lose the ability to, in some cases, to stop dividing, and they divide so rapidly that they create a cancer. And so here is a picture of a basal cell carcinoma. And these are just a bunch of basal cells that have simply lost the notion of when they should stop dividing. And because they continue to do so, they produce a little tumor. And so that's what you see there, this little basal cell carcinoma. So for these, mostly, they will be treated either with surgery or you can freeze them off. There are also some topical ointments that can be used. These are not super aggressive cancers. And they're quite frequent. They're definitely the most frequent form of cancer in human beings, and they're not terribly worrisome. But we do tend to take care of them either with one of the methods I talked about. Now, a far more aggressive cancer is known as the squamous cell carcinoma. And the squamous cell carcinoma actually affects cells within the stratum spinosum. So as you recall, the stratum basale produces new cells that are pushed upward through the epidermis, and one of those layers is the stratum spinosum, usually about 8 to 10 layers thick. And the stratum spinosum has these very active cells producing keratin, and these cells, because of their activity of transcribing and then translating those genes into proteins all the time, are also quite at risk of UV exposure. And if they get damaged, they can also have the same effect of not knowing when to stop dividing. And so these cells, these squamous cells in the stratum spinosum, begin to divide very rapidly and produce tumors and lesions. And so here you can see a squamous cell carcinoma on someone's nose. And that's actually, these are very common kinds of cancers, but also very aggressive. And these, unfortunately, do tend to metastasize. And what metastasis means is that those cancerous cells can break off from the original tumor and move to other parts of the body, sparking new tumors in other places, often in other kinds of tissues. Like they can begin to form in lymphatic tissue, they can begin to form in a number of other places. And once you get a metastasized cancer, you have a much deeper problem, health problem. So these are called squamous cell carcinomas. A third kind of cancer that is found with the integument is a melanoma. And all these must make much more sense to you now than they did before, because the melanoma is a kind of cancer that begins in melanocytes. And you've learned in this chapter about melanocytes. They're found down within the stratum basale. They produce the product known as melanin, which can be pinched off in these vesicles and spread out through the skin to provide a pigment within the skin. And of course, that protects the body against these UV radiation, although it takes a little time to build up that resistance for something you would call a suntan. Anyway, some of these cells basically become hyperactive because of DNA damage. And when they become hyperactive, they produce lots and lots and lots of melanin. And this gives these sort of asymmetrical patches on the skin of very dark areas because of the excess melanin that's being produced in this area. So these are the melanocytes that have just gone haywire and produce these melanomas. Now, melanomas are definitely something to be concerned about. They can metastasize pretty regularly as well. And so usually you need surgical excision or immune therapy to deal with these. Doctors will give you the ABCDEs of melanomas. How can you tell if you're looking at something on your body that's a freckle or a mole that's actually quite benign and would never cause you any major problem? How can you tell if any of those might have instead turned into a melanoma, or maybe had been a melanoma from the beginning? This is an interesting piece. They will basically ask, is the mole asymmetric? Do the two sides of the mole seem symmetrical? And if they're not, and they're asymmetrical, that is of concern. Number two, look at their borders. Are the edges irregular? If they're perfectly smooth, probably not a problem. But if they're irregular like this, notice how irregular this is. Kind of looks cauliflower-ish, and definitely irregular in nature. That could be a problem. The color. If the color is constant across the entire mole, probably not a problem. But if it varies in shades across the structure, then it probably is indication of a melanoma. And here you can see very dark shades, some more purpley shades, some brown, some black, and so that variation in color is concerning. And then the diameter. If the diameter is larger than about 6 millimeters, this can be of concern. It just shows that this is probably not a typical mole and benign, but something that is more concerning. And then is its shape changing? That's the E for evolving. Sometimes they'll also add firm and growing. Is this an elevated feature on your skin? If it is, that's of concern. Is it firm? Does it feel much, much harder to the touch than surrounding skin? And is it really growing? So these are the A, B, C, D, E, E, F, Gs of melanoma. So take a look at those. That's of some interest. Other skin disorders include allergic reactions that generally we refer to as eczema. And I'm not going to talk much more about this, but just to say that allergic reactions can create these red rashes and patches on the skin referred to as eczema. It's a dry, itchy patch of skin that often starts out red, and can cause patients a lot of distress. It's usually treated with creams, corticosteroid creams, which will tend to reduce the amount of inflammation. Moisturizers can be helpful, and often they are actually treated with immunosuppressants, because what's happening in those dry, patchy areas is that your own immune system is attacking your own body. That's called an autoimmune response, and so a lot of times this eczema will have to be treated with something that can suppress your immune system with that. Finally, or not finally, but also acne is an issue that arises with the integument. And usually the problem with acne is that you have overactive sebaceous glands. So these sebaceous glands will produce a lot of sebum, and at the same time you got keratinized cells that are producing a ton of keratin. And sometimes it actually will block the pore that should release this sebum out to the surface of the skin. And you can see it's backing up here. The sebaceous gland and the sebum is expanding around the hair follicle. And this produces, a pimple on the edge of the skin here, which is really just an inflammation of the epidermis above the sebaceous gland. Sometimes it'll start out white as all that sebaceous gland material collects, and then eventually it turns black because the sebum actually oxidizes when it finally comes in contact with air, and so this produces a kind of immune response as well, and damage to the skin from this inflammation. Can cause scarring. So acne is basically a problem typically based on overproduction of sebum, and then some related consequences. Sometimes you'll have bacteria that colonize these areas. This particular bacterium here, known as Propionibacterium, or Staphylococcus, can become involved. Okay. Finally, if we look at some other injuries, we understand that burns are a typical problem, because it's your external exposure to the environment. If it becomes burned, if your skin becomes burned, it's a major issue. Those are usually categorized in degree. You have first, second, third, and fourth degree burns. And first degree burns are just superficial burns, and then fourth degree burns are much more severe. They usually are penetrating all the way through the hypodermis and down, and affecting the tissues that underlie the hypodermis, including muscles and even bone. So a fourth degree burn is really, really bad. It often is actually not very painful because the nerve endings themselves have been damaged, and so if you don't feel a lot of pain from a deep burn, that's actually a sign of something really bad, the fourth degree burn. You can take a look at the different ways of estimating how much of the integument has been burned. I won't ask that on the exam. I'm also not going to ask too much about scars and keloids. If you'd like to read a little about them, keloid is a specific type of scar, but I'm not going to focus on that in the exam. I will ask briefly about bed sores and stretch marks. So let's quickly talk about that. Bed sores typically happen in elderly patients, and sometimes just patients who are paralyzed for a variety of reasons. And what's happening is that any place where the skin is being compressed steadily for long periods of time, and that's usually because it's overlying a bony structure. And then the weight of the body pushing down on that bony structure and kind of trapping the skin between the bone and the weight of the body and the mattress below, or whatever you're laying on, that action reduces blood flow to that part of the skin. And if you get no blood flow to that part of the skin, some of the tissues will begin to die. And that necrotic tissue, that dead and dying, stratum basal and the stratum spinosum and so on above it, those areas will end up having dead cells, and they become necrotic. And so that's actually what a bed sore is. And you can reduce the probability of getting bed sores just simply by moving patients around frequently. If they can't move themselves, helping them roll over, making sure you massage areas of the skin regularly that are overlying bony structures is a great way of making sure you continue to get blood flow to those areas. So they are avoidable, but it's very, very difficult once a patient becomes very immobilized in their bed. And the second thing is stretch marks. Stretch marks happen simply where any time there's a fast-growing structure beneath the skin, which is stretching the skin out, and the skin simply can't keep up with it. So, for example, if you are growing very rapidly, let's say bone and muscle is growing very rapidly, or even fat deposits are growing very rapidly when you're younger, the underlying structures are growing so rapidly that the skin just can't keep up. The stratum basale cannot produce cells rapidly enough. And because of that, it will produce these thin areas, which are stretch marks. And they just have to be, they just look a little different than the rest of the skin. And so for cosmetic regions, sometimes these are treated, but, they typically don't have any kind of health problems associated with them. Okay, and that concludes Chapter 5.